common problem all over this country, but particularly in this part of the country, in the southeast, particularly in this part of Georgia. A lot of people have coronary disease and atherosclerotic disease. The arteries that feed the body and feed the heart are blocked up, clogged up with cholesterol-containing junk. Okay? You know, there are a lot of reasons why people have this, but needless to say, it's a problem. This problem can lead to disability, even death, in terms of heart attack, stroke, and loss of circulation to the legs. We now have the ability in our program to be able to open up these arteries to give people better quality of life and even save lives. This is called interventional cardiology, or interventional endovascular care. We have the ability now to diagnose, not only diagnose arteries that clog up the heart, but also treat those clogged arteries with something called angioplasty and stents. Angioplasty is basically putting a balloon in an artery and opening that artery up. The balloon is deflated, and we inflate it and push the material out of the way. In the past, if you had a heart attack, the best we can do for you was either to give you a drug into your vein that would have to get into your entire circulation that would break up clots. Not only clots in the artery that's clogged up, but clots every place. So bleeding was a major risk. The other alternative was to put you in an ambulance or a helicopter and fly you to Savannah or Jacksonville, taking an inordinate amount of time sometimes to get you to a laboratory that could do that. It's important that we have this technology here in Waycross because we now can provide that service locally. We know that giving angioplasty is much better than giving these clot-busting drugs. Speed is pretty much everything. We like to say in the heart community that time is muscle. The more time you spend trying to get an artery open, or the more time you waste trying to decide whether or not if this is indigestion or a real heart attack, the more muscle damage you have. The more muscle damage you have, the higher the likelihood that you're going to have premature death. So speed is very important. That's why it's important not only that patients who think they have a heart attack come to our hospital as quick as possible, but it's important for us to be able to diagnose the problem and treat it. That's why our heart team here is ready and waiting to be able to take care of patients who come in with heart attacks.
Here is a disc from an interventional cardiology case that I did at another hospital. This patient presented with unstable angina. It turns out he did not have a heart attack, but he had evidence on stress testing of large areas of his heart that weren't getting enough blood. So we did a diagnostic heart catheterization. And I'll just show you some of the lesions that we found and what we did. This view shows the catheter that is in the mouth of this patient's left artery, and the artery on top is the anterior descending, and the one at the bottom, this projection, is a circumflex. And already you can see that there is a significant narrowing in the mid to distal part of his circumflex artery. Here's another projection, and you not only see in this projection the disease in this circumflex artery, but also in a branch of his anterior artery, a diagonal branch, which is a pretty large branch, there's a lesion. So he has 2 lesions in his left artery. And this is a catheter in his right artery, and he's got a narrowing that's sort of moderate at the beginning, but at the very tail end, there's a significant narrowing here in his right artery. So he has 3 vessel disease, unstable angina, and we decided to intervene and do angioplasty and stenting of 2 of the vessels and bring him back for a 3rd. Okay, we're back in the left artery now, and this is a different kind of catheter called a guiding catheter. It's a little larger, but it has a very thin wall, so you can get more things into the lumen of this catheter. You can see in this projection there is a wire that is into the artery, planted distal into, in this particular case, in the diagonal branch. And this is a special balloon called a cutting balloon. It has some tiny blades that when the balloon opens up, the blades push out and sort of crack and cause fissures inside the artery. And I decided to do a cutting balloon on this vessel. and the wire is still in the artery. You can see that's the result. This is just a plain cutting balloon result that looks pretty good. I'll fast forward and show you the wire now in the circumflex vessel. This is the wire, and we've done angioplasty already, and we decided to put a stent in this artery. This is a stent in place, and the stent inflated, and this is our result. You can see this artery is nicely patent, and in this view this is a diagonal branch, in another view that's nice and patent. So we have a successful 2-vessel intervention, and I can tell you that I brought the patient back and did the 3rd vessel, and he's doing quite well, not having any symptoms, and hopefully with no smoking, exercise, diet, and taking his medication, including cholesterol medication, he should do fine.